Hello and welcome to McLaren Port Huron Today's Health Program. I'm your host, Kelly DiNardo. Today I'm speaking with Dr. Todor Toromanovski about the role of a family medicine physician and about some health risks that may affect older adults during the warm summer months. So Dr. Toromanovski, thank you so much for joining us today.
Thank you for having me.
And so you're new to our area. Tell us where you practice.
Yes, I practice in St. Clair in the McLaren Community Health Center right next to Neiman's grocery store on Kearney. I am there 5 days a week taking in new patients, and we have x-ray and lab capabilities on site. We also have a couple of specialist groups that come in during the week. We have an OBGYN, general surgeon, and an orthopedic surgeon rotating through the clinic.
So you practice there with Dr. Laura Renke, is that right?
That is correct, yes, with Dr. Renke, who's been there for a number of years. I've been in Michigan for over 3 years. Currently live in Detroit with my wife and 16-month-old.
Oh, so you're very busy.
And travel to St. Clair daily.
Very good. So you are a family medicine doctor.
That's
just
correct.
From the basic, what does a family medicine doctor do?
Family medicine doctor, by definition, sees everyone from newborns to the elderly. Frequently, we also have, as the name suggests, families that we take care of. I've had in the past entire families under my care. The assumption is we're there to treat colds and we refer everything else, what I've heard from some people, but we do a lot more than that. I myself treat multiple conditions and minor procedures, removing moles. We also serve as kind of the main doctor that coordinates care, referring to specialists when the need arises, making sure that we oversee the complete care of the person that's under our care. Some of us will also see patients in the hospital. I do not. Some of it is also sort of like a patient advocate.
Yeah, so it's like you know the whole person.
Basically, yes.
Yeah.
And it's a very involved specialty. It's we're kind of with the person through their lifetime, through all aspects of care, and it's very rewarding for us as physicians just to be in that role.
Mm-hmm. I've heard from some people that they wish they kind of were quick to go see a specialist, and in hindsight they would have wished they would have maybe consulted with their family practice doctor first, because it could have saved them some steps too.
Yes. Many times we're able to treat what the problem is right there in the office. However, if the problem becomes too involved or it requires more than one doctor, then we'll be more than happy to refer to where the patient needs to go.
You follow up then with that specialist too, so like
Yes.
It's more of a coordinated effort.
For sure, yes. Coordinated effort. I myself make sure that whenever the patient goes and sees somebody, that I have all the current information from that specialist and that I'm aware of what is happening. And a lot of the times, I will call the specialist myself and get some clarity on the situation. As I establish myself more in the area, that will become easier. I've been in the St. Clair area for about 4 months now, so I'm still getting to learn the different specialists. But Dr. Renke has been of great help. We work side by side, so.
That's great. I can imagine that could be really overwhelming for someone. I mean, especially an older adult that maybe has several specialists. They see a heart doctor, a GI doctor.
Yes.
So you're kind of that.
A lot of the times they come in and they say, I'm not sure what I should be taking, or, you suggested this, my specialist suggested that, what should I do? A lot of the times we serve as kind of as a guidance for them as well, because it can get confusing. You're correct. People, I have patients that have 3, 4, maybe 5 specialists that they see, and it takes a lot of effort to keep up with those appointments on their side,
Right.
and to keep up with all the medicine and make sure that they're doing what they're supposed to be doing. So when they see me or family medicine, internal medicine, any general practitioner, then they may have a lot of questions about what they should be doing, how they should be doing things. Clarity.
Right, and I think there maybe was a misconception, like you had said, people think they just go to the doctor for colds or when it's needed, but really
Right.
it's important to have those annual physicals. So is that
Of course.
kind of a newer guideline?
So those annual physicals, that's I've heard a lot of times from patients. They say, "Well, I come to your office. Let's say someone has a lot of comorbidities and they need to come and see you monthly or every 3 months." And they say, "Well, I've been here so often. Why do I need this?" Right? That's the common question. And the reason why we have the physicals is we take the time during that visit not to particularly address anything specific, but to look at the whole picture and make sure we have the correct medicine. We make sure that appropriate screening has taken place. For example, for men, colonoscopy is up to date, or for women, mammography is up to date, things like that. Just to make sure that the overall health picture, that we have that, and that everything is up to date, so to speak. So this is why those are important once a year.
So you are taking new patients.
Yes.
How would someone that's interested in seeing you be able to contact you?
They can call our office, or I'm not sure of the website. Maybe we can put it up.
Yes.
There's also a way to make an appointment online.
That's great. Though this has been really good information, we do need to take a short break, but we'll continue our discussion when we return.